Hello friends and welcome back to my channel. Welcome back to the part 3 of the atypical question. So let's start with the new series of the question. First is a case over typhoid fever. So we all know that typhoid fever, the route of transmission or route of spread is fecal-oral. But remember to mark the correct answer is waterborne transmission. Next is the case over full-term babies born with the first known complicated pregnancy, complicated by labor, diagnosed with the cephalhematoma. On the second day, this and this happened. Even though if RH and RH factors are given in the question, what you will mark in the cases of cephalhematoma, sir, what happened is cerebrocranial birth injury. Remember about the correct answer. Next is why this fracture is uncomplicated, because neural symptoms are not there. If the fracture reaches to the spinal cord or affect the spinal cord, it will be complicated fracture. What we will see in the patient, neurological symptoms which are not here mentioned in this question. Next is Cushing disease. Why? Because ACTH level are increased. Next is idiopathic thrombocytopenic purpura. What are the hallmark finding? Hemorrhages on torso plus thrombocytopenia. Next is immediate life-threatening thoracic injuries are pneumothorax, massive hemothorax, open pneumothorax, cardiac disruption or tamponade, tracheal disruption, and aortic transection. These are the life-threatening injuries. Maybe you can remember them or maybe not. Next is the case over a primigravida with the pregnancy. This and this terms has headache, nausea, pain in epigastrium. Objectively, she is having face is hypertrophy and short fibrillar twitching of the this and this muscle, face in the extremities. BP is severely high, and this respiration is high, and appreciable edemas on the inferior extremities is present. Urine is cloudy. What medication should be provided? Remember about this case. This is not the first line solution, but still it's just a relaxant. As of I know, it's just a patient's relaxant. So what you will give in this question instead of this answer? You will give droperidolum. Please repeat with me. You will give to the woman with the severe preeclampsia or eclampsia with the BP 200. What is the correct answer here, sir? Droperidolum. How much? 2 ml. Droperidolum of 0.25%. You can take a screenshot if you want to remember better. Next is rough estimation of the pulse. If you can palpate these pulses, you know that systolic blood pressure is roughly this number. So in this region, you can see the regions over there. Remember with the photogenic memory that if you see these regions, so you can make the rough estimation of the pulse with the systolic blood pressure number. Next is main differences between the cystitis, pyelonephritis, vaginitis and urethritis. So what you will remember is the main thing, urinalysis and bacterial test. In the urinalysis, see the cystitis, bacteria are mild, WBC mild, RBC can be severe, but in KROK question mild, specific gravity mild. In pyelonephritis, WBC more than cystitis, bacteria a lot of bacteria, cylinders cannot be, specific gravity increased. Vaginalis WBC because infection, slight changes with the bacterial. And in urethritis, WBC affected, RBC affected, bacteria will be mildly pleasant. Main thing to highlight here is if we have talked about all the profiles in our description regions, but main thing to remember is the bacteriological study. If you cannot remember all of the things, but urinalysis is important to remember. However, it can differ in KROK question, but bacterial test is in cystitis positive, in pyelonephritis positive Promax, in vaginalis positive, urethritis positive. Next is 3 weeks later tonsillitis. So 3 weeks later is what pathology? Chronic tonsillitis. Tetralogy of Fallot, mnemonic for it, PROVE. Prove the tetralogy of Fallot. Prove the tetralogy of Fallot. P is pulmonary stenosis. R is right ventricular hypertrophy. O is overriding aorta. V is ventricular septal defect. Prove the tetralogy of Fallot. Peak flow meter is green zone is asthma in good control. Yellow in asthma is not in good control, getting worse. Red is severe asthma. What is peak flow meter test? The patient used to this is used to measure the expiration of the patient, expiration flow, how strongly a person can expire out of his lungs, because asthma is the expiratory dyspnea. Next is classification of the severity, divided into intermittent and persistent. Intermittent is less than 2 attacks per day or per week or per 2 days, less than 2 attack per week. Mild asthma asthma, more than 2 attack, but weak but not daily. Moderate, daily attacks. Severe, all day attack. Once again, a classification of asthma severity divided into intermittent and persistent. Intermittent, less than 2 days per week. Mild, more than 2 days per week but not daily. Moderate, daily attacks. Severe, all day attacks. Next is, you can remember which leads will show you which type of MI. So you can take a screenshot and read well. Next is, which region will highlight what kind of problems. So if we see, this is the quadrants are mentioned over here. So the top, the right subcostal area is typical for hepatitis, cholecystitis, cholangitis, pneumonia sometimes, or some abscess. And under this area is kidneys will be there, pyelonephritis will be there, stones will be there, abscess can occur over there. And the right lower quadrant is appendicitis, more prone for ovarian torsion, testicular ruptured ovarian cyst, abscess over there, tubo-ovarian abscess. Ectopic pregnancy can be suspected in the right lower quadrant pain. In the epigastric region, in the middle, in the epigastric region, what can be suspected? So GERD, acid reflux. What can be suspected? Gastritis. What can be suspected? Pancreatitis. And in the region below the epigastric region, around the navel and periumbilical region, what you can suspect is mesenteric ischemia, more common. And under this area, in the suprapubic region, what you can suspect is most commonly cystitis, sometimes ectopic pregnancy. And on the left upper quadrant, what can be there? Problem with the spleen abscess can be there, spleen rupture can be there, some sort of pneumonia can be highlighted on the X-ray. Under this quadrant, what is there? Kidney stones can be there, pyelonephritis can be there, abscess can be there related to the kidney. Under this area, what can be covered? So diverticulitis can be there, ovarian or testicular torsion, the same as another quadrant. Rupture ovarian cyst can be there, cyst can be on the both side. Ectopic pregnancy can be on the right and left both side in the lower quadrant. Next is, which organ is present where? Abdominal anatomy. A quick recap for you, maybe someone forgot something, that in the upper right quadrant, what is there? Liver, gallbladder and biliary ducts. Under this is colon, small intestine and right kidney. Under this is appendix, colon and ovary. In the middle portion, in the epigastrium portion, what is some leftover part of the liver, some stomach part is there, pancreas is there. In the umbilical region or the paraumbilical region, what is there? Colon is there, transverse colon is there, small intestine is there, aorta is there. Which aorta? Sir, mesenteric aorta. Under this region, what is there? Sir, bladder and uterus are over there. On the right side, what is there? On the left upper quadrant, some left part of the stomach, left over part, I mean, not saying the left or right part, I'm saying that in the upper left quadrant, some leftover part of the stomach, it will be there. Pancreas tail will be there, spleen will be there. And under this part, under the left upper quadrant part, what will be there? Colon will be there. Which colon? Leftover parts of the transverse colon and the leftover parts of the descending colon. And small intestine will be there, left kidney will be there. Under this will be colon. Which colon? Sigmoid colon. And the left ovary will be there in the cases of female. Next is a summary for the appendicitis. My friend sent me this, so I thought to cover it with you. Pain should be in the periumbilical region. It may start in the periumbilical region, then later will move to right quadrant, the right lower quadrant. What is the symptoms? Nausea, vomiting, anorexia, low-grade fever, the symptoms related to the bacterial infection. Physical examination is McBurney's point tenderness, or what we say rebound tenderness. Diagnosis, blood test, elevated WBC. In cases of elderly patient, WBC will be mildly elevated. Yeah, go for emergency appendectomy. How we can diagnose it? We can diagnose it through the CT. What is this? Gold standard diagnostics. Ultrasound for children, MRI if needed in some cases. Background background will be surgical emergency, often due to obstruction. This and this happened in the patient, the sudden attack in the right lower quadrant. Treatment is laparoscopic appendectomy. Even if we open the abdomen for some another reason, maybe for checking the colon or something, what we do is all the time a preventary appendectomy, that even if the appendicitis occur in the patient next time, we don't have to open the abdomen just for appendix again time. So even if you are doing gastrectomy, even if you are doing colonotomy, what you will do is, sir, we will do preventary appendectomy if we open the abdomen. This is the modern practice how we are doing, because we want to see the patient healthy. What you will prescribe after the appendectomy? Antibiotics to prevent the infections. Next is burn area determination. How you will determine? Rule of palm. Next is what are the degrees of the burn wound? First is epidermal burn, then is dermal plus superficial burn, then is deep, third degree is deep dermal deep burn, fourth degree is subfacial burn. And other classifications are also there, but remember the simplest. You will be able to solve the question easily through the simple. Next is quick SOFA. For what we use the quick SOFA? For the severity of the patient's sepsis. So any of the two should be present. Systolic BP can be less than 100 mm of Hg, respiratory rate more than 22 breaths per minute, altered mental status by the Glauco scales. This will be less than 15. Any of two are present in the patient. What is the sign? Sir, quick SOFA is positive and the patient is deteriorated with the sepsis. Next is difference between DKA and HSS. So in the glucose levels in DKA can go up to 600 milligram per deciliter. In HHS they can go up to more than 600. The pH should be acidic, less than 7.3. pH in DKA is acidic. In HSS more than 7.3. Bicarbonate less than 18, and HSS more than 18. Ketones positive in DKA, in HSS negative or maybe mildly positive. And osmolarity mildly elevated, but in cases of HSS highly elevated. Anion gap increased. In HHS variable, can vary, and not very important. This table is not very important, but for some questions, or maybe being the students of 6th year, we should know about this table. Yeah. Next is 30-year-old patient with the complaints of low-grade fever, decreased appetite and performance, sweating in the night. And come to the X-ray findings. Actually, X-ray reveals a dense focus of the medium intensity, 6 mm in diameter, in the segment S2. So in the segment S2, what is there? Upper lobe of the pulmonary system. So upper lobe, who will affect? Tuberculosis loves to eat the upper lobe of the lungs as dinner. So what you will mark in this question? Sir, dense focus is there. So what you will mark? Sir, focal pulmonary tuberculosis. Next is first read about the celiac disease once again. So what are the symptoms related to celiac disease? So diarrhea, abdominal symptoms will be there, weight loss will be there, fatigue will be there, anemia, rash, bone and joint pain will be there, and non-digestive symptoms are there, like neurological symptoms will be there, headache and peripheral neuropathy, ataxia can be there, reproductive issues can be there, infertility or delayed puberty, and once again anemia, skin rash, bone, joint pain. So abdominal, the digestive system as well as non-digestive system, plus neuro symptoms and reproductive issues. Read the new question. This is the new question which my friend sent me. So, the mother of 8-month-old boy complains of the abdominal distension in the child, copious foamy stools. We got our GI symptoms. What is the with an unpleasant odor? Weight loss. Weight loss. The bowel movement changes and the weight loss we got already. The child's skin is pale and dry during the examination. Increase in the abdominal volume. Another GI symptom. And hepatomegaly is determined. A complete blood count is anemic. Anemia is present in the patient of celiac disease. A complete blood count shows anemia. Biochemical blood loss of the hyperproteinemia, hypoalbuminuria, a decrease in cholesterol, total lipids and alpha lipoproteins. Establish the diagnosis based on the result. What is the correct diagnosis? Celiac disease. So, it's not in the option given here, but the correct answer is celiac disease. And what you will mark in the question? Celiac disease. The answer is D or E. Another option I got cropped. So Let's see, celiac disease, another questions over celiac disease. Quick recap, you can pause the video and recap once again. However, we covered the celiac disease in another video already. Next is the patient complains of nausea, shortness of breath, and decreased urine output to 400 ml per day, which is low. Anamnesis, it is known the condition developed after taking the gentamicin. Objectively, the patient is pale or swelling on the face and leg, pleural friction rub, moist trails are heard during the auscultation. According to the result of the blood test, creatinine is 560, potassium is high, and in the urine test, proteins, mild proteinuria, mild erythrocyturia in the fusion of view. What is the fusion of Wild? Sir, we look at the eyepiece of the microscope, and whatever we can see is the eyepiece. So you may confuse in some question that what is this, like the erythrocytes 5 to 7 in the vision field. So vision field is when you put your eye on the microscope, whatever you can see is the area of vision, the vision field. So in this case, what is the correct answer, sir? Correct answer is acute renal failure. The renal system got failed. That's why these first of all creatinine is given here, and electrolyte imbalance occurred there. Proteins are leaking up. Sir, what happened? The kidney function got failed. What is the function of the kidney? Sir, filtration. The kidneys are not able to filter well. Why? Because decreased urine output. So when there is no formation of urine, what happened? Lost kidney function, which is filtration. So what is the diagnosis? Acute renal failure. Next is following the indicators were calculated in the analysis of the population, this and this, this and this. So total cardiovascular morbidity is this, cardiovascular is this, proportion of cardiovascular mortality with total mortality is this, primary displacement caused by the cardiovascular disease is this. So what indicator is an extensive value? Sir, extensive value will be proportion of the cardiovascular morbidity with total mortality. Please remember about the case. We might have covered it already in the social medicine, but I highlighted it here so that you won't forget it easily. Proportion of the cardiovascular mortality with total mortality. Next is a very atypical question. Try to get it with the focus now. 9-month-old child with an acute respiratory viral infection was receiving antipyretics in the syrup. On the second day, the patient noted their child developed red rash, neck edema, hoarse voice, barking cough, difficulty breathing, agitation. In the family medical history, the anamnesis is complicated on the father's side. What is the most correctly diagnosis in this case? So you told that when there is hoarseness of the voice, just mark the stenosing laryngitis and move on. Sir, most of the time the answer will be like this only. That's the correct mnemonic. Remember about that also, that hoarseness of the voice is the character of our larynx. So when laryngeal stenosis is there, most of the time the answer will be laryngeal stenosis. Then only we see the hoarseness of voice. But in this case, what happened is the patient took some antipyretic syrup, which after which what happened is the patient noted their child has developed skin redness. Skin redness is what? Skin allergy out of antipyretic induced skin allergy. What are the symptoms associated with this allergy? Neck edema, hoarseness of voice. Sir, why hoarseness of voice in this case? Because neck edema is there. So in this case, the problem is not with the larynx. The problem can be with the larynx, but the case is for the Quincke's edema, not the laryngeal stenosis this time. So what happened in the patient? A Quincke edema or antipyretic induced Quincke edema. Please remember about this case. Next is the patient suffers from peptic ulcer disease of the duodenum. Disease is of moderate severity, which is fine. So he wanted to assign to a disability group. What do you think? A person with the peptic ulcer can work or not? He is making some excuse here, right? So he is capable of working, and he is an employee. So he is not disabled. Yeah, he is just having a peptic ulcer disease, which can be easily treated. We have advanced care nowadays. So he is capable of working, employee. The patient is doing what? Making excuse for the fake holidays. Next is the boy had some functional and morphological abnormalities. He has no chronic disease. During the last year, he had 5 cases of respiratory disease. What health group is this? Sir, second group. You told us in the social medicine already that first group contains less than 3 times per year child who gets sick, and second year will be more than 4 times. So here is more than 4 times. What is the answer? Second one. You can read this table once again. We covered it in social medicine already. Next is who will increase the holidays after the 4 months. It will be a socio-medical expert committee or medico-social expert committee. So please remember about this, a quick mistake which we all make. So after the 4 months, who will increase the holidays? First 4 month will be prescribed by Medical Advisory Commission, MAC. A comes before, so MAC, first 4 month, MAC. All right, MEC will be more than 4 months. So MEC, MSEC or SMEC, the same case is over here as well. So SMEC, MSEC, so all are the same things. So after 4 months will be, the option will contain something E. All right, E comes after the A. So you can read this case which we just discussed, and in this case is the patient is on sick leave for 4 months continuously from the date of the injury. What treatment is going to last for the another 1-2 month? Who is authorized to exceed the duration of the medical certificate in this patient? So MAC after ME. So first A will come in the option and then E will come in the question. So please remember about this atypical question. So Medical Advisory Commission after the Medico-Social Expert Commission. The question may seem illogical, but remember our favorite technique is first A will come, then E will come. So first A is there, advisory, then E is there, expert. Next is a workshop president makes the list of workers who are ill for special supervision. He takes into an account number of etiologically connected cases resulted in the temporary disability that occurred in the span of a year of each worker. So how many such cases should a worker have to be included in this group? So they are having the case of temporary disability. Please remember about it. If they are talking about temporary disability, the case should include the severity. So 4 is the ideal typical answer. So the patient should get at least 4 times and more times ill, so that we can classify him in the temporary disability category. Please remember about this atypical question. Next is hemorrhagic vasculitis. Why? What is typical here? Sir, 2.5 erythematous rash is typical here, and weakness in joint related to the changing skin, and large joints are painful, pain attack, paramedical area, and intestinal symptoms we have got. So intestinal hemorrhage, GI symptoms plus erythematous spots are there. So what you will mark? Sir, we will mark hemorrhagic vasculitis. Next is a 6 centimeter dilation. Cervical shows 6 centimeter dilation. What you will do? Delivery with the natural birth canal, even if the pelvic size is low, and amniotic sac is unbroken, the fetal breech presentation is there, and the fetal birth rate is given. So even if the question is wrong, doesn't make enough sense, but we have covered it in gyno that even if all the wrong things are present, all the indications for C-section are present in the question, and if the dilation is 6 centimeter, what you will do? Delivery through the natural birth canal. We have written here, even the breech is there, even a lot of things are there. If the dilation is 6 centimeter, remember about this atypical question. What you will do? Delivery through the natural birth canal. Next is some people keeps on sitting in the front of the screens all the day. So what it will damage? So visual capacity, visual analyzer. Next is the patient severity is given in the question. What you will do? Urgent electrical cardioversion. So delirious syndrome. What was our mnemonic for delirious syndrome? Distorted, hallucinated, agitated. So find the hallucinations are there, and the patient is agitated as well. The patient is disoriented as well. What is this syndrome? Delirious syndrome. What is the mnemonic? Disoriented, hallucinated, agitated. And what they are asking about? What index? What you can make with the index? You can make a B with the index. Sir, you told about this mnemonic in the social medicine. So answer will start with what? B. So bed turnover. And do not mug up with this bed resources of the hospital. There was no answer like this. So please remember what index you can calculate with this data. Bed turnover. And in this case we talked about in last videos, the acute onset, if there, what you will mark, thrombophlebitis. When chronic onset is there, what you will mark, venous varicose veins. So what is the answer here? Venous varicose vein in the left leg. Why? Because condition is chronic from 5 years. A 35-year-old woman complains of the pain in the lower leg. Pain intensifies during walking. Objectively, the skin on her right lower leg is red, hyperemic along the varicosity of the small venous vein. A palpation detects an oblong painful in duration of 3.2 in the size in the upper third of the lower leg. What complication of varicose vein has developed in the patient? So thrombophlebitis. They have given the size as well. So when they are given with the size in the question, what you will mark, thrombophlebitis, sir. Remember the onset something is not given, but you can consider, right? The patient complains of pain in the right lower leg. So when she will complain about the pain in the right lower leg? After 5 years? No, she will not wait for it. She will go to the doctor immediately. So the onset we consider in this question is acute. What you will mark with the question with the acute onset? So thrombophlebitis. With the chronic onset, what you will mark, venous veins or blah blah, something like that. Next is the 2 days ago. Onset is 2 days ago. What you will mark? Sir, thrombophlebitis. Another option says what? Another option, no option says about thrombophlebitis. What is the answer here? Acute ascending thrombophlebitis of the venous vein in the left leg. Next is also the case, chronic condition, 5 years. What you will mark? Venous varicose vein in the left leg. And this is first read this. When there is any trauma or any anisocoria. What is anisocoria? One pupil is dilated, one is constricted. The difference between the sizes of both the pupils. So in the cases, what is this anisocoria indicating? Sir, brain herniation. So brain hernia, can you see with another things? Can you see with the lumbar puncture? No. What you will do first? CT. So in the cases of trauma and anisocoria, what you will do first? CT. And if the fever and neuroscience are there, like neck stiffness and another meningeal syndromes, what you will do? Lumbar puncture. In this question, what is given? Anisocoria. What you will do first? Brain CT. In this question, what is given? Sir, fever is given. Sir, what else is given? Sir, meningeal syndrome or hyperparesthesia, convulsions, some vomiting or some fever is given, and BP is also given. What you will do first? Lumbar puncture. About the shock we have talked about, when they are asking about diastolic BP is 50. So which category of shock is this? Second degree. We talked about it in the last video. What degree is the shock? Second degree. And next is okay, first read about this. When the patient is stable, then in the cases of embolism, so when the patient is stable, how you will know patient is stable? Normal BP. What you will give? Low molecular weight heparin. When the patient is unstable and BP is given in the terms of shock, or so what you will do? Urgent embolectomy. If you can't use heparin, what you will use? Vena cava filter. So let's hear it from patient. 45-year-old woman is undergoing treatment for the active rheumatism combined with mitral valve disease. During her morning produces suddenly means what? Embolism case. Sensed pain in the left hand, which was followed by the numbness. Pain in the numbness continued to aggravate. The skin on the left hand is pale and comparatively cold. Pulse in the hand artery is absent along the whole length. What treatment tactics? Pulse is absent. What would have happened? Some embolism. How you will treat it? An urgent embolectomy. Why? Because her hand is pale and cold. Before we have to amputate the hand, please correct the patient with the urgent embolectomy. Do not wait for the low molecular weight heparin or anything like that. And next is here what is given? A normal condition of the patient. What you will prescribe? Low molecular weight heparin. And vena cava filter is given in this option. That's why I decided to explain you guys in this table. You can take a screenshot and okay, you can read the whole profile, and what it will show, the severity of the patient is fine. The BP is not very low, so it's fine. Prescribe low molecular weight heparin. So in this question, what is wrong? Sir, OD correction is wrong. So what you will do? OD intraocular correction. Why did I highlighted this question? Because you guys are marking glasses OD plus 10 SMPH OS plan. What you will mark from now? OD intraocular correction and move on. Next is homicidal strangulation. What is homicidal strangulation? Murder. Rare but possible. That signs of defensive wound signs will be there, that the patient tried to protect himself, so in the course of protection he will get some injuries. So this is the case of murder, or let's say homicidal strangulation. Suicidal strangulation is more common. There will be no wound or no signs of struggle will be there, because the person want to hang himself. So this is personal choice. And accidental strangulation, so it can occur in some cases of asphyxia. No suicidal intent, but mechanical asphyxia leads to death. So it's similar to something accidental strangulation. What is this? Sir, murder. Next is murder because other people are trying to hang him. So and the person doesn't want, he is screaming and the person doesn't want to get hanged, so they are punishing him. This is legal procedure though, but what is this called? Murder. Next is I hope you remember about this case already, so let's read it one more time. External obstetric examination shows the mother's belly is ovoid, fetal bag can be palpated in the lateral position. Lateral position, it means the baby is in which lie? Sir, longitudinal lie. So right portion, there are some small fetal part, and uterine fundus, there is a firm ballotting part. Fetal heartbeat can be heard on the left about the navel, and which what is the lie, what is the position, what is the presentation of the fetal. So what is the position? First position. So remember about this case, guys, that lie is longitudinal, position is first position is which one? Breech position. When did they say about the breech position? Fetal heartbeat above the navel, and lateral position of the uterus, right portion, and there are uterine fundus in small the fetal back. In the first line itself they said about it, the fetal back can be palpated in the lateral position of the uterus. So which presentation is this? Sir, first position, breech position, in which the buttocks of the buttocks of the baby will be near to the vaginal opening, and head will be near to the uterine cavity. Next is sir, clear border, clear margins are given in the question. What you will mark? Erysipelas. And next is about the burn. So when there is 2 to 3A given in the option, please choose it without using too much of the brain. However, the patient got thermal burn of the both of the hands. The epidermis of the palms and back of her hand is exfoliating. The case study and blister within the serous fluid are forming. The case study is given related to the second degree burn, so they estimate is around somewhere between 2 to 3A degree burn. Next is most probably in the KROK question go with the 3A degree burn and 2 to 3A with the option. I did not see a question over another burn. So this and this case study is given, please read it and mark correctly 3A degree burn. However, let's read it with me. The wound of the bottom is whitish gray, and its pain sensitivity was reduced. Why the pain sensitivity is reduced? Because the pain receptors got burn in the cases of third degree burn. After the treatment, bandage is soaked with the solution of this and this, and on the 29th day after the burn, the necrotic scab came off. So what it highlights? Severity of the burn. Which type of burn it is? Third degree. Even if the question doesn't make sense to you, sometimes I'm telling you what to mark if you cannot make sense, right? In the cases of burn, when 2 to 3A is given in the option, go with it. And when this is not given in the question, go with 3A. In the cases of frostbite, what option will be the best for KROK? The first degree frostbite. All right. Same question, remember about it. My friends sent me these doubts. And remember about what is the hepatitis type B, what you will do as a complication of hepatic cirrhosis. So renal system would have got affected, so what you will take? Renal needle biopsy this time. Next is the same question. And Kandinsky syndrome we have done in psychiatry. What is the hallmark here? K for controlled by external forces, and K for Kandinsky. And next is hysterical neurosis. What the patient is feeling? Fake sensation of round body in the throat, which is stress induced of failing the exam, which is a fake sensation. Next is derealization. What is the hallmark finding? Sir, the trees are upside down. The patient is looking at the surroundings, that trees are upside down. So this is the case of derealization, which we have covered in the psychiatric part. This is the case of collapse. How the profile of collapse will be given? Suddenly happened. The patient was in some meeting and suddenly fainted, and the BP can go up to very lower ranges in the cases of collapse. So 44-year-old man hospitalized with the perforated stomach ulcer 5 years ago. Onset of the disease, the diagnosis is confirmed by this and signs of diffuse peritonitis is increases. The patient is okay. The signs of peritonitis are increased. What we are supposed to do, sir? Urgent surgery. But the patient is with the schizophrenia. The man refused to the surgery, so he will die. Schizophrenia patients are very stressful. Please watch the video over the schizophrenia. They feel intense episodes of getting anxious and getting scared. So the patient is scared. What he will do, sir? This we cannot decide it because we want to save the patient, but the patient doesn't want it, right? He's scared out of surgery. So this is a multidisciplinary discussion. We will discuss with all the doctor. We will keep a urgent meeting for this one, and we will act according to the condition that what will the best for the patient. So multidisciplinary discussion is called what? Convince a council. Council is what? All of our friends or all of our department surgeons, which will take a correct decision for the patient. Look at the other option as well, but remember to mark about the convince a council, which is a multidisciplinary discussion. Next is in hemophilia A, what you will give? Cryoprecipitate. In hemophilia B, what you will give? Fresh frozen plasma. Next is the case profile of 10 days after birth. Newborn developed what? Developed sudden fever up to 38. Objectively, the skin of the region at the navel, abdomen, in chest, and this with blister, nose, bright red, moist erosions, epidermal fragments are observed on the periphery. So remember about the keyword. This is the case related to something atypical. Yeah, that is newborn skin diseases. Maybe you have seen it in there in this that portion as well. But remember about it. Epidermal fragments are observed. So epidemic pemphigus of the new. Next is trichophytosis, capitis, scalp ringworm. We talked about it in last video. How you will treat it? We will give antifungal, which is griseofulvin. Next is the case study. You can read the case here. So this is the case related to the trichophytosis capitis. Let's read it together. First of all, let's read once again all of them. The cause is fungal. Sign is oval pink red patches and broken hairs with the blur. Oval pink red patches with the blur margin, broken hairs, wood slump, which is no green flow, wood slump negative. Let's see the question over it. 14 years ago, the patient complains of foci in his scalp. The patient is presenting with this condition from 2 weeks. Objectively, the scalp, there are some oval foci with blurred margins. Please remember, oval foci with blurred margins, and the skin over the foci is pink red. The hairs are broken off 4 to 5 mm on the left, and at the skin level under the wood slump there are no foci. So wood slump is negative, and which is supposed to show green luminance here. So what disease is suspected? Trichophytosis capitis. How you will treat? Griseofulvin. What dose is? 20 to 25 mg per kg per day. This is what? This is burn. We talked about the stages again. A quick way to remember is first degree burn will be red and painful. Second degree burn will be blisters with painful. Third degree burn will be white with no pain. Why no pain? Because the pain receptor has also been burned. Fourth degree burnt to the bone, the total necrosis. This is modified version or full version. However, your questions can solve through the easiest way as well. But if you want, you can read this more highlighted version as well. So in the first degree, epidermis only, red painful, no blister. In second degree, epidermis plus part of dermis, red blisters, painful, very painful. And in third degree, epidermis plus superficial dermis, pale, dry, pain reduces because of burned receptors. third degree B epidermis plus full dermis. In third degree A, the pain just reduces. In third degree B, the pain is lost because in third A degree, some of the receptors are burned, pain receptors. In third B degree, all the receptors are burned. In the fourth degree, what is involved? Skin plus deeper tissue, muscle, bone, black, no pain. Black because everything is burned. No pain, receptors are burned. What is the case? Severe. Next is a case over twilight state. So the patient will be aggressive, angry, and patient behavior is a destructive action. What he is doing objectively, the patient is distorted. The case of epilepsy, yeah, we talked about it in psychiatry. Without any cause, suddenly patient became excited and aggressive, and personal identity in the environment, visual and auditory hallucination, threatening content and delusion, and reference. And the patient is aggressive, so what you will mark, sir? You will mark the twilight state. Sir, what was the mnemonic for the twilight state? Tell me in the comments. Next question. So next patient is 18-year-old patient, always obeys to others, and his need of hand adapts his need to the demand of the people whom he depends. So he is excessively defers to their wishes and make them responsible for his well-being, cannot depend his interest and needs support from the other people. So the patient is perfectly dependent on others. So what is this disorder? It's a dependent personality disorder. Next is the patient claims that the young man says what, this is not his not his nose. Where is this written? He thinks that it's impossible to live with this such a ugly nose. So what the patient claims is that this nose is not his. So dysmorphomania, that this nose is not mine. This nose, I don't like my nose. This nose is not mine. Dysmorphomania. Next is maniac episode. A maniac episode is what the people with the maniac episode claims. Tell me in the comments. What was the mnemonic for the maniac syndrome? High mood, high energy, no sleep. So the case of the behavior at workplace, and she accused the management of understanding, claimed that she can be the deputy director because she speak 4 languages. It is very attractive. However, can make useful connection for the company. She has been dressed something atypically, flirting with the colleagues, singing loudly in the office, flirting, and the patient is with the high energy, high mood, and no sleep is required. So however, she speak no foreign language, she is talking bullshit. So what is the mnemonic for the manic syndrome? High mood, high energy, no sleep. Next is delirium tremors. The patient had a this and this vodka. So and later, what on the third day developed something, no sleep, become anxious, believed that he was at the factory, and he could see a horror movie on the wall, heard screams of the some screams which are trying to kill him, or which threats him to kill. After alcohol, what will develop? So delirium tremors. This is the sign for the right upper quadrant for cholangitis or cholesterol something. On the neck, what we detect is Musi sign, positive for in the cases of cholecystitis. On the near the gallbladder, what sign is more is positive? Murphy sign. So when the patient inspire, you press the Chiari point, as I have highlighted here. Find the Chiari point under the subcostal region of the patient. So under the Chiari point, what you are going to do is you are going to press the Chiari point and ask the patient to inspire. So when the patient will inspire, if the patient also reports the pain, the Murphy sign is positive. And this is the location, or the rough location of the pancreas. Just so you know that pancreas is located very near to the umbilicus. Once towards the gallbladder is the caput, or towards the spleen is the tail of the pancreas. What is Ortner sign? Sir, we try to thump on the patient's left and right subcostal areas. If the patient reports pain on the right subcostal area, this is the case of Ortner positive, which will highlight some pathology with the coli system, that cholelithiasis or cholecystitis or whatever you can think about it. I just wanted to highlight the signs because we see these signs in a lot of questions. So anything else in this one? Yeah, enough. So cheilitis is caused by the deficiency of riboflavin, which is vitamin B2. This is yeah, peeling of skin or whatever they say, peeling of skin. Yeah, so peeling of skin is caused by retinol, the deficiency of vitamin retinol, which is A probably. What is which of triad? Sir, this is the triad which we use in the DIC syndrome, in the patients of DIC syndrome. What is the pathogenesis? Sir, endothelial injury, abnormal blood flow, and hypercoagulability of the blood. Take a screenshot and remember well. Next is psychosis without P. What is psychosis without P? Caused by Streptococcus aureus. What you will see in the patient? Sir, rash over the beard area. What is psychosis with P? Sir, this is neurological. So delusions, hallucination, catatonia, and discoordination thinking. So problem with the psychosis. So remember about psychosis without P and psychosis with P. So there was some question in crocology about psychosis. They gave about the beard rash. So just so you know, I highlighted it here. So benign tumor and malignant tumor. Benign tumor will be soft in nature. Malignant will be hard in nature. Benign tumor will be painless usually. Malignant will be initially painless but later develops the pain. The benign tumor can be mobile. Malignant tumors are probably non-mobile. So benign tumor shows you the well-defined border, and malignant shows the irregular because it is more destructive. Progression of benign is slow, malignants are fast. The spread of benign tumor is slow, and the benign of malignant tumor is the spread of malignant tumor is fast. So so this is a basic rough table for you to understand a little bit about it. However, there is a lot of atypical things are given in the KROK questions about the tumor, cancer, benign and malignant. But remember, for the knowledge purposes, that this is our rough estimation that what will be the differences between benign and malignant tumor. Next is this is the same case. The vaginal examination shows 6 centimeter of the dilation. What you will do? Delivery through the natural birth canal. Next is this case we have covered it in the portion of other ovarian tumor as well. But however, let's read it one more time. 52-year-old woman complains of general weakness and pain in the lower abdomen. She has a 2-year-old history of the post-menopause. So objectively, her abdomen is enlarged and signs of ascites can be observed. Gynecological examination determined that the cervix is cylindrical and clean, which is fine, and the body of uterus is deviated to the right. So behind the uterus there is a lumpy, painless, dense, immobile mass. And sir, please do not mark the endometrioid cancer in this one. And as I have you can see that I have marked it incorrect too. So after the post-menopause age, what happens is the risk for ovarian cancer increases. And however, what will be the profile? Sir, lumpy, painless, dense, immobile. Immobile should be what? Please remember, we just talked about it, that cancer is immobile. So please remember about this case. Next is endometrioid cyst on the right. Please remember, we talked about it just a few minutes ago, I guess. So what is there? The signs of endometriosis. But what you will mark? We will not mark endometriosis, we will mark endometrioid ovarian cyst on the right. Sir, why? Because all the things are related to in the question are given to the endometrioid cancer, but they give us the mass here. What is this mass? Sir, this is cyst, which is most common in the woman. This is torsion of the ovarian tumor pedicle. What will be what will be given in the question about the profile of the ovarian torsion of the ovarian tumor pedicle? So it will be elastic formation with the in the right ovary. Pregnancy test will be negative because there is no ectopic pregnancy. And complaints of sharp pain in the lower abdomen because of torsion. Torsion is rupture or something got strangulated over its axis, or something due to ischemia. So what will be there? More intense on the right, because it is the right sided case. Difficult defecation. Remember that in the question of when the in the question of torsion of ovarian tumor pedicle, they are highlighting the difficult defecation as well, which will help you to diagnose or make the hallmark of it. So please remember about the profile. Painful dense elastic formation 5 into 6 when given. So this is related to the torsion of the ovarian pedicle. So I hope you will remember it. Next is chronic myeloid leukemia, which is also known as Mylosan. And Kandinsky syndrome we have done. Mnemonic is K4 Kandinsky, K4 controlled by external forces. Pelviperitonitis. Why not ovarian apoplexy? So you told that when vaginal fornix is overhanging and sharply painful, please mark the ovarian apoplexy. Sir, please read the whole profile of the case study. The Blumberg sign is positive, which is the sign related to the pelviperitonitis. So you can if you are going to mark the apoplexy or ovarian apoplexy, please make sure that the question contains posterior ovarian this posterior overhangs, vaginal fornix overhangs. But please at least read the whole question. The sign of the Blumberg sign, the sign of peritonitis is given in the question. So what you will mark in this case? Peritonitis. Next is exfoliative dermatitis. Why? Because the peeling of epidermis is given in the question. Next is typhoid is water borne in the questions. Neuroarthritic diathesis, because nocturnal incontinence related to the neurosystem, and more symptoms will be there. We have done this question already. You can find symptoms of uterine fibroids. What are the uterine fibroids? Some leiomyoma or myomas. What are uterine fibroids? They are simply the non-cancerous growth that will developed in or the uterus. So heavy menstrual bleeding you will see in the patient, pelvic pain, frequent urination, constipation, lower back pain during intercourse, and enlarged abdomen. In the case history, the history is given in the question. Uterine fibroids, go with the answer uterine fibroids, which are also known as leiomyoma and myoma. In the cases of lumbosacral radiculitis, what you will give? Sir, NSAIDs. And mnemonic for fibroids, F4 fertility issues, I4 irregular periods, B4 big uterus, R4 rounded mass, which is uneven surface, O4 on manual examination uterus will be mobile and firm, I4 increased bleeding, signs of anemia, D4 dull lower abdominal pain. Please try to recall instead of just reading the mnemonic. Try to recall it so that it will be stored in the long-term memories. Next is emphysema of the lung. The main key point is X-ray shows flattening of the diaphragm. So please remember the mnemonic. In emphysema, the diaphragm of sema is what? It is flat. All right, emphysema of the lungs. Next is nodular uterine leiomyoma. We talked about it yesterday as well. Let's see the case history one more time. 32-year-old woman complains of itching pain in the lower abdomen. We got our first point, itching pain in the lower abdomen, and intensifies during the painful menstruation. So she has a history of 2 abortions and no childbirth. Objectively, the skin is pale, abdomen is soft and painless, tumor-like palpation is over the pubis. Bimanual shows what? Shows the body of the uterus is enlarged up to 40 weeks of the pregnancy, which is dense, mobile and uneven surface. Appendices are not palpable. So what you will mark in the question? Nodular uterine leiomyoma. Next is depersonalization. The patient lost personality. He look at himself like alien-like his limbs are there. Next is tinea vesicular. So remember about the signs of shaving. S4 signs of shaving, S4 noted around the C, S4 vesicular. So please remember about the tinea vesicular case. And in this case, why not double blind study? What is double blind study? Double blind study is when the doctor as well as the patient doesn't know what are they taking, right? In this case, what is there? They were divided into 2 identical groups taking into account of their age, sex and stages of disease. One group was receiving treatment with a new drum, while other group was undergoing traditional therapy with the control study. Participants did not know what therapy was they receiving. So doctor knows what therapy were they receiving, right? So if the doctor knows, when the doctor as well as the patient doesn't know what are they taking, then it should be double blind randomized study. When only the patient doesn't know what they are taking, the blind randomized control study. Histamine level 2.8 time higher given. What is this? Sambrotoxicosis. Hemorrhagic vasculitis we have done. Silvery white scales. What is this case? Psoriasis. In the syphilis, what you will do? Artificial termination of the pregnancy after a course of antisyphilitic therapy. And in this case, you can remember the early latent syphilis when there will be no clinical manifestations of syphilis will be given in the patient. This is the case of early latent syphilis. Remember not to mark the latent recurrent syphilis. There is nothing like latent recurrent syphilis. Remember please to mark early latent syphilis. Please take a screenshot and look at my mistake. What I did is I marked latent recurrent syphilis. What I had to mark is early latent syphilis. Now we know that there is nothing like recurrent syphilis or something with the patient. When the examination shows no clinical manifestation of the syphilis in the patient's skin, what you are going to mark is early latent syphilis. Next is primary syphilis. So the rash should be located where? Let's see the patient. 38-year-old man complains of the ulcer that appeared on the area of the head of penis. So it is primary syphilis. Head of penis is in the primary syphilis. Where is the rash? Sir, mouth, rectum and genitals. Next is torsion of ovarian pedicle. We have talked about this. What are the hallmark findings? Sir, more on the right, sharp pain in the lower abdomen, more intensifies on the night, difficult defecation. So remember we talked about this case when the defecation is given in the question. This is not the hallmark for torsion of ovarian pedicle. This is something which we know from the question that examiner will give us this. So detected a painful dense elastic formation, this and this in the area of right ovary, and pregnancy test is negative. What are you going to mark? Torsion of the ovarian tumor pedicle. Next is 26-year-old man undergoing the regular checkup for 1 year ago. He had a case of tonsillar diphtheria complicated by myocarditis. So presently his condition is satisfactory and no signs of cardiovascular failure are given. ECG shows first degree AV block. What vaccine should be administered? So remember about this case please that we are going to give a adsorbed diphtheria tetanus vaccine which is modified version. So please remember about this. Don't give any DPT or another vaccines in this case. What you are going to give is absorbed diphtheria vaccine. Which version? Modified version. Next is the patient says in autumn 55-year-old patient developed or recommended the electric surgical for the coronary artery bypass grafting due to the multivessel coronary artery disease. The patient has never received the anti-influenza vaccine. So why would the family doctor offer a scheduled yearly vaccination against the influenza? So because it is never contraindicated in the patient, so this vaccine we can prescribe anytime, so decrease the risk of mortality due to pneumonia and heart failure. So please remember to mark about this question that the influenza vaccine is never contraindicated in the patient. So what you are going to mark in this question is decrease the risk of mortality due to pneumonia and heart failure. This case, Hoar's voice, intercostal retraction, Hoar's voice. What is this case? Stenosing laryngotracheitis. Next is the patient eat canned meat, canned mushroom, so botulism. Next is paroxysmal ventricular tachycardia. The new treatment is amiodarone. Don't mark lidocaine. Next is for anthrax you will give penicillin. For typhus you will give doxycycline. For chlamydia you will give macrolides. For trichomonas metronidazole. Next is hallmark finding for idiopathic thrombocytopenic purpura, hemorrhages on torso and thrombocytopenia. Next is the umbilical hernia is given. We have talked about it. I hope you remember the triad now that umbilical hernia is the character of congenital hypothyroidism and the weight of the baby is also there, so weight is extra. So what you will mark congenital hypothyroidism. Next is what stage of chronic kidney failure this is? Sir, this is compensated because kidneys are able to filter some 34 yet. So this is not the terminal, latent or nothing else. This is compensated because kidneys are still able to filter some 34 per ml per minute. So we have covered this question. This is what? This is arterial flutter. This is how the ECG will look. So next is the case of paraumbilical region pain. So this is the part of salmonella endarteritis. We have covered it. Foreign body removed under the nail and has problems now. What is this case? Subungual paranecium. And asthma severity we talked. So problem with the systolic murmur, problem with the aorta, diastolic murmur, problem with the mitral issue. Correlation coefficient less than 0 will be inverse relation, more than 0 will be direct relation, as more as positive, strong relation, lesser positive, weak relation. So more negative, strongly inverse, weakly negative, weakly inverse. So next is the patient says that 35-year-old man complains of the chest pain in which persists the several symptoms for the months already, and occasionally observed that bitter taste in his mouth, and the pain is localized behind the sternum, occurs at rest. So the pain is more typically epigastric pain, so which intensifies during the physical exertion but may be intensified after drinking alcohol as well, or eating after the large meal. So what is this case, sir? This is the case of acid reflux case. This is the case of GERD, because the epigastric pain, and which is provoked by alcohol and a lot more things, or spicy food. So, and in this case, a parturient woman is 23-year-old. Internal obstetric examination shows the uterus to be completely open. Fetal bladder is absent. Cephalic presentation is observed, and the plane of small pelvic outlet. Sagittal suture is on the longitudinal section of the small pelvic outlet, and small fontanelle is situated closer to the uterus. So what cephalic presentation you will mark, sir? Minor oblique lie. If there is some another logic for this question, I'll ask my friend to comment over this. Objectively, there is a hyperemia, painful formation in the yellowish tip near the edge of the eyelid. Sir, what is this this thing near the edge of the eyelid? We call it stye. And trichomonas capitis, you have seen it. What you will prescribe to the patient? Griseofulvin. What is the cause? Fungal. What is the key sign? Oval pink thread patches, broken hairs, wooden slump, negative, no green flow. Next is epidemic pemphigus of the newborn. Why epidemic? Sir, epidermal fragments are observed on the periphery. So epidermal fragments observed. What is the case? Epidermal pemphigus of the newborn. Next is they wanted to, what parameter will allow to characterize the circulatory related mortality in this city? So mortality, or let's say cardiovascular mortality, or let's say intensity parameter, or mortality rate, all of the things are similar things. So remember about this, that this will be what parameter will allow to characterize the circulatory related mortality in this case will be intensity parameter. What is this? Case of UTI. What you will prescribe in the cases of UTI? Ciprofloxacin. What is this? Urolithiasis. Why? Because the pain is sudden pain. First of all, the pain is pain attack, like sudden pain in the lumbar area. And what is there? Pain in the lumbar area, costovertebral angle tenderness. And pain is what type? Radiating pain. Why? Pain on palpation on the kidneys along the ureter. So pain is radiating from kidney to the ureter, right? So the case of some stones. Next is exfoliative dermatitis case. So why exfoliative dermatitis? Peeling of epidermis is there. Placental abruption and uterine rupture, what are the differences? In abruption, the pain will be sharp. In rupture, the pain will be sudden, because rupture happens suddenly, right? And in the bleeding will be dark in the cases of placental abruption, and heavy in the cases of uterine rupture. The uterus will be woody hard in the cases of abruption, because too much blood is filled in the uterine cavity due to the abruption. And the uterus will be in the cases of uterine rupture, the uterus will be relaxed after rupture or empty feeling. Heartbeat will be absent in both the cases, because both the cases blocks the fetal blood supply. Labor activity can be absent in abruption, and rupture can be often during labor. Next is fibroadenoma. What is this? Why fibroadenoma? Because on palpation there is a painless firm mobile lump of 2 cm diameter. Nodes are without alterations. In the upper quadrant of the right breast ultrasound, there is a massive neoplasm with increased echogenicity, size this and this. So this is what? This is fibroadenoma. Remember in the portions when we were talking about the tumors, what we did it, that a woman who has self-detected the tumor in the upper quadrant of the right breast, on palpation, this is what? This is firm, this is mobile, this is lump, this is 2 cm. So please remember about the case. Revise the tumor portion very well before the exam itself. It will be covering all of the question related to the tumor. So next is placental abruption. Typical is what? Vaginal bleeding and sharp pain. And Cushing triad is the signs of shock are tachycardia, tachypnea, hypotension. The signs of intracranial pressure increase will be opposite to the signs of shock. Next is adrenal insufficiency. insufficiency. So what is acute adrenal crisis or adrenal insufficiency? So acute in nature. So etiology, what can cause this? So sudden stop of glucocorticoids or some another chronic disease can cause this. So how you will diagnose this? Sir, through the hormone disbalance we can diagnose it. What is the treatment? Sir, hydrocortisone. Next is chronic one. Chronic version is also known as Addison's disease, primary adrenal insufficiency caused by the adrenal gland destruction due to autoimmune factors. Addison disease is what? Autoimmune, right? So chronic infections, diabetes mellitus, and skin hyperpigmentation. These are clinical pictures. Skin hyperpigmentation, weight loss, fatigue, hypotension, hyperkalemia. This is what all you see in the questions of KROK. So this is what chronic version of adrenal insufficiency. How you can treat it? Glucocorticoids. And clinical picture of the acute cases is what? Acute abdomen, nausea, vomiting, altered mental status, shock, and many more. So this is what showing. This is a picture showing adrenal gland, and what is it? Hemorrhagic destruction of the adrenal gland. So look at the destruction of the adrenal gland. Next is climacteric or menopausal syndrome. Climacteric syndrome, what is this? So symptoms which occur due to stop of menstrual cycle. Average age is 49 years. So etiology is what? Decreased ovarian follicles due to the estrogen production. So symptoms what the patient will see? Hot flashes, disturbed menstrual cycle, mood changes, insomnia, and dryness over the vaginal area, weight gain or difficulty in losing weight, memory problems or the difficulty in concentrating. How to diagnose the climacteric syndrome? Increased FSH will diagnose it. How to treat it? So best treatment is estrogen and progesterone therapy or behavior therapy. Diet, exercise, and physiotherapy can correct the climacteric syndrome. This is what? This is our beautiful gland of the eye. Which gland? Meibomian gland, right? So when the question is asking about some glands, the patient is feeling something uncomfortable while reading or something. So this is responsible. Meibomian gland is responsible for the tear secretion, right? So when the patient is feeling something uncomfortable due to this and this, so what you will mark? Sir, Meibomian gland is involved. Next is torsion of ovarian pedicle. Please remember about the profile. We have talked at least for 4 times in this video itself. Please do not mark it incorrect. I hope from you. Dense elastic formation, size is given, right ovary. So what happened in the patient is torsion on the ovarian tumor pedicle. So pain is in the lower abdomen. Next is genital herpes infection. What will be typical? Burning sensation in vulva plus multiple vesicles on vulva. Echo is used for structure and function of the heart. Doppler echo is used for the blood flow as well as the presence of pressure of the heart. TMT test, treadmill test, is used for the ischemia detection. Bicycle or velo ergometry is used for the alteration to TMT test. The patient who cannot run, we will ask them to run the bicycle. Ventriculography is ejection fraction plus, will show the ejection fraction plus the wall motion. So we have covered all of these things in the investigation portion, so do not forget about them. This is what? This is emphysema. So see, the diaphragm of sema is what? Diaphragm of sema is flat. And next, ACTH elevation is typical for Cushing disease. When you see the urine is bloody, this is the complication for which drug? The side effect of rifampicin. This is what? Pleural empyema. Pleural empyema is what? Pus filled in the pleural cavity, which will be the result from the infection. How you will treat it? Drain the pleural cavity and prescribe antibiotics. Quincke's edema, we have seen this atypical case, that in this case what happened is the skin itching, skin redness or neck edema is induced by, this is the case of antipyretic induced Quincke's edema. Another thing, pleural empyema, the x-ray shows, come to the x-ray finding directly. X-ray shows what? Shows a on the right a shadow with the fuzzy margin up to the level of rib 2. Sir, up to the level of rib 2, what is this? This is not the case of tuberculosis, as I myself marked the wrong. So up to the level of rib 2, what will be there? A lot of fluid will be there, and 90% neutrophils highlight what? Bacterial infection. So this is the case of pleural empyema. Remember about it. Do not mark incorrect, I hope from you. Next is also the case of pleural empyema. Look at the profile of the question. X-ray shows what? Homogeneous darkening of the right half of the chest. Please remember about pleural empyema. I think in the last video we have talked about the abscess very well, the atypical question related to the abscess. This is chronic onset. What you will mark in the question: subcutaneous varicose vein in the left leg. In the acute cases, what you will mark: thrombophlebitis. This is the onset is not given in the question, but the patient complains the pain. So pain would have happened. The onset you consider in this question is acute. So what you will mark in the question: thrombophlebitis. 2 days ago onset. What you will mark in this question: thrombophlebitis, because acute onset. This is what a 30-year-old female patient has been delivered to the hospital for sudden dyspnea progressing as asthma, sensation of having lump in the throat, head tremor, fear of death related to the neuro symptom. Yeah. So objectively respiratory rate is high, pulse is elevated, AP is elevated. The patient is having his rapid superficial vesicular breathing with the extended expiration. Percussion finding says heart borders are not changed. Cardiac sounds are loud. This is the case of asthenia. Which version? Neuro version, because fear of death is present there, which is neuro symptom. So this is the case of neurocirculatory asthenia. Please remember about it. In the cases of cerebral edema, what you are supposed to give to the patient? Mannitol. But what you will give according to the KROK question? Furosemide, which is more typical for the pulmonary edema. But now we know that in the cases of cerebral edema also, what we will give? Furosemide. This is what patient shows. Patient was found dead in his own garage. Forensic examination detects the horizontal closed strangulation mark, petechial hemorrhages on the skin of the head and neck, facial cyanosis, marked liver mortis, and there are some spots they found. What indicates the man did not die by hanging. So the horizontal strangulation mark which is given in the question is the answer to your question, that this is the main sign here which indicates that the man did not die by hanging. Next is what is this? This is my routine for happiness. Which version? Natural version. So what to do in the morning? Things to do to keep yourself good in the exam sessions or during the last days of the exam. What I do is technocardio. However, you can hear to your favorite music. So what is cardio? Cardio is simply you need to feel the activities. What is the benefit? The benefit you will get is you will feel active all the day. And what I'll do is push up as well at the same time with the cardio and push-ups. Why push-ups are so important? Because they will increase your total lung capacity. You will be able to breathe enough to stay active all the day. What is yogic breathing? Some breathing by the means of yogic techniques, whatever I am doing here is pranayama, kapalbhati, bhastrika, bee breathing, and lotus pose. These are the yogasana which I am performing for myself. However, if you are a beginner, you can just try the bee breathing and half lotus pose and feel the benefits. And why I'm drinking green tea? Because sir, it is an antioxidant which keeps me calm down throughout the day and keep my heart relaxed all the day. So a lot more benefits of the green tea. Maybe you know, meditation is to keep yourself calm throughout the day. Affirmations, what you do in the affirmations, you look at your stronger version of yourself. You imagine yourself that you are stronger, so it will charge your subconscious brain and you will feel good. You will know the things, that how the things are going to change as soon as you will receive the success. So gratitude journal, I write the gratitude journal sometimes. What do we write in gratitude journal? Sir, if someone spoiled our mood in the day, or if someone did something very good for our day, we write thankful to both of the person or both of the thing. What we write in the gratitude journal is thanks to the pain given by this and this person during that time. And what you write is thanks to this and this person for doing this. So you write thank to each and everything whichever happened in the day, whatever has made good for you, whatever did bad for you. So you write a thank you and move on, let go. So this is it with this video. Hope you enjoyed the video, and let me know in the comment box if there is something which you are marking incorrect. I'll add the questions in the next video. So this is it, and take care, take enough breaks from the study sessions. Have a nice day.